anticipating Medicare's ultimate demise in the not-so-distant future, as well as other potential reductions in Medicaid benefits recently mandated by Congress, we'd like to propose a plan that will cover all Americans from the cradle to the grave and will ultimately eliminate the need for Medicare, Medicaid, and the CHIP programs. This proposal also contains the mechanics for creating the equivalent of a single-payer system that's not a federal or state governmental agency. Almost half of all Americans have healthcare insurance through their employer, and the majority of those insured are quite satisfied with their plans. We'd like to suggest that large group plans be formed that are not based upon where we work, that, for the most part, people can join any plan they choose, and that plan stays with them from cradle to grave unless they decide to make changes, even when they switch jobs or go off on their own to start a new business. In addition, we'd like to highlight the following 6 points. Number 1, since all Americans will be covered, pre-existing conditions will no longer be an issue. Number 2, deductibles and copays are based upon one's modified adjusted gross income, on one's ability to pay the deductible. Number 3, although most Medicare participants will pay less with our plan than what they currently pay, some will find it costs less using Medicare and can choose to continue with that program. Number 4, those laid off or terminated from employment, such as those laid off during the COVID pandemic, for instance, that encountered difficulty in retaining, obtaining, and or paying for healthcare insurance for themselves and their families, would still be able to maintain coverage under our proposed program. Number 5, insurers that currently provide healthcare insurance for employer-based plans will be able to continue offering those plans, subject to making certain required modifications. But they will now expand those plans to cover those not employed by the companies that they currently insure. And number 6, it is not necessary that this proposed plan be implemented immediately on a nationwide basis. A select group, region, or state might be selected. Any difficulties encountered may be tweaked, and the program then expanded. Please watch the following 2 videos. They explain the basics of the plan and provide additional information for employers, healthcare providers, and healthcare insurers, including an explanation of our suggested single-payer system. In addition, this website contains a written document explaining all the specifics of the plan in greater detail. If you are in favor of our proposed plan, or in favor of the basic elements of what we suggest, please contact your local U.S. congressional representatives and U.S. senators. A final note, as new data regarding our national healthcare system is constantly evolving, any corrections or additions to the embedded YouTube videos found on this site are contained in the written explanations to the plan. We thank you for your time.